So, welcome to the March Journal Club, Medical Education Journal Club. And I think most of you who know me, I've been PRing how excited I am about this journal club. When I returned from AAMC in November, there was so many great rhyme papers, research and medical education papers presented. These two I heard the presentation on and were certainly at the top of my list to share with the Northwell community. So I'm very excited to go to the north of us, to our wonderful neighbors, Canadian neighbors, today and have Shiphra Ginsburg and Andrea Gingerich with us. So we're going to be doing two papers today, which is a rarity for us. So we're on a pretty rapid fire situation here. And we do want some discussion. And both papers are dealing with a topic that I always say, it might sound a little dismal, that I'm going to put on my tombstone. I conquered the feedback puzzle, or the feedback enigma, because I don't know how many years I've been talking about how to give feedback. And these two people are certainly dedicated to that. And why can't we just get this right about the feedback dilemma? I mean, it's not that hard if we follow the best guidelines, which you'll hear today, some of that. And it is so important to the learning process is feedback, and especially in the context of formative feedback. So, so important to our learners at all levels, students, residents, fellows, even faculty. So this is a really exciting opportunity to have these two papers. Dr. Ginsburg is going to start. I'm not going to do a big introduction. I'd rather her just say a few words about herself and her passion for feedback. She actually came in person to Northwell before the pandemic. John Young, who is a master educator at Northwell, brought her to the Department of Psychiatry, so most of you did not meet her. And then Andrea, I don't think, has been to Northwell. She's from the west side of Canada, British Columbia. So we have the Eastern Canada and the Western Canada represented here today. So without further delay, I'm going to start with Dr. Ginsburg, and then we'll have a somewhat discussion about her paper, and then we'll move to the second paper. And you want to share
Thank
your
you, Alice. Yeah, so the usual, let's just see what everyone, come on, we just tried this and it worked. Um, what can you all see? Are you seeing my slides? Are you seeing my notes or just the slides?
the slides, right?
Perfect. All right. Well, thank you so much for this invitation. Like you said, passionate about getting feedback and assessment right. And we have spent a lot of time looking at feedback in terms of delivery and how to do good feedback as faculty. But this is kind of flipping it and looking at a little bit at the other side. I'm a clinician scientist here in Toronto. Very happy to still have American friends across the border. We won't mention tariffs or anything like that. But I will say that my, excuse me, I've been very lucky to collaborate, including with Andrea, who's giving the next talk. So I'm going to assume that people have the paper, maybe have skimmed through it so that I can kind of hit the highlights and leave more time for discussion. I also want to note that I made my the graphics for this presentation using artificial intelligence, which was actually really fun, and happy to answer questions on that. So, what is feedback seeking? We can consider it as a proactive search for information in the environment to help someone obtain the goals they need. And this is a socially constructed phenomenon, so it can shift with context and with the people seeking and receiving. But the important thing is sometimes it really truly is people asking for feedback because they truly want to improve and improve their performance. But there's also elements of seeking feedback that have to do with impression management and trying to look good. And excuse me, we value this so much, this idea of feedback seeking, that we've turned it into a required competency because we think it shows that someone's engaged, mature, open to feedback. But we sometimes neglect that it's really difficult for learners because it's an act of vulnerability and they don't know what kind of response they're going to get. And most of the research on feedback seeking has looked at factors that may predispose someone to seek feedback, but we don't know how supervisors view those requests for feedback. And here's where I want to pause because these perceptions matter. So if you think someone's asking you for feedback because they sincerely want to improve, or if you think they're asking for feedback because they're kind of brown nosing and just want to look good, you may approach those feedback conversations really differently and make different assumptions about the learners. And so for our study, we drew on a couple of theoretical frameworks. The main one comes from organizational psychology, where they actually do a lot of work on feedback seeking. And the main three um, reasons people seek feedback are either to attain a valued goal, that's instrumental, or ego, to protect your ego, or image, to actually enhance your image. And in medical education, they took this a little bit further and looked at, and you can look at these definitions in the paper, self-assessment, self-improvement, self-enhancement, making yourself look good, and self-verification, just checking to see if your perceptions are correct. So there were some gaps noted in the literature, including we don't know what feedback seeking has as an effect on supervisors, and whether or not it can be detrimental in some situations. For example, if you're getting tons of feedback seeking requests, people are coming to you all day long asking for feedback, it can impose a burden. And we actually don't know how people decide, is this a genuine request or not? And so that was the goal of our study, to look at how supervisors judge feedback requests and how it might change the conversation. And we used constructivist grounded theory, interviewing 17 faculty across multiple specialties. And the way we had organized this is, I think, Alice, you wanted us to pause after the intro and methods to see if there's discussion, and then do the same after results. Is that correct?
Certainly, if anybody has any thoughts about the methods, that would be wonderful. Just because I love to introduce the concept of medical education research methods. We're talking
Mhm.
to a medical education scientist, I would say. So, the qualitative approach to this.
So if anyone has any
Was this
questions,
the main question that was asked in your quality? Was this the main
yeah,
question, Shiphra, that was asked in qualitative approach?
that's right. So we asked people, when you are approached by a learner for feedback, essentially, how sincere did you think that was? And we asked them to come with examples of when they were approached for feedback and felt it was very genuine and sincere, and why that was, and all the surrounding information around the context of that request. And similarly, a time that you really felt that that feedback request was not sincere, and why. And then we iteratively interviewed, like I put here, COVID hit partway through, so it actually took us like 2 years to get 17 people. And we sampled across multiple specialties. If there's no questions, I can continue, and then
And
we can come
those,
back to methods
okay.
anytime.
Anybody have a question about this? Or feel how you would feel as a supervisor with this question being posed to you?
I see a
Thinking
hand
about
up.
that ahead. Stacy, maybe you could help me, or
I see
Leanne,
someone
with
named
whose
Elizabeth.
hand is up.
Yeah,
Okay, go ahead, Elizabeth.
Yeah, thank you very much. And I'm so privileged to be here. This is fantastic, and it's one of my favorite research methodologies. My question is, your interviewees, were they in what ranks of supervision were they? Could you elaborate a little bit?
Yeah, so it's a good question because we wanted to make sure that we were getting a range. So we had junior people that were just recently out of training themselves, and some very senior faculty. And we had people that supervised and gave feedback in inpatient settings, outpatient, operating rooms, so a variety of settings. So maybe I'll go on to some of our results, and I'm sure there will be more to discuss. So
I just want to ask
this
one
is,
quick question.
oh yeah,
Did you consider academic rank?
Um, yes and no. I mean, it was more about seniority. We wanted people with varying levels of experience.
Okay,
So,
thank
yeah. So, the first major thing I want to present is people did perceive specific motivations for seeking feedback. And similar to the theories I showed you, we classified them as being a need for affirmation, like sometimes you just need to know you're not a total ditz. Improvement. Quite a few people said, I give everyone the benefit of the doubt. Everyone wants feedback. Everyone wants to get better. Yet they also noted that sometimes it's a challenge because, and this is the title of our paper, I think many of them want to appear to have a growth mindset. So they noted that this could be difficult to tease out. Another perceived motivation for seeking feedback is getting your assessments filled. We have our competency-based medical education requires multiple workplace-based assessments. And this idea of can you just fill this out? Can I get some feedback? Is one motivation. They're just trying to tick all the tick boxes. And then there was a thought that there were some hidden motivations. Like it seemed like the person was kind of sucking up or feeling me out before asking for a reference letter. And we asked them what they based their assumptions on. At first, some were a little hesitant, like they didn't know and they didn't want to assume. But with some gentle probing, they did come up with several underlying motivations, including the initial request was one big one. So how they were approached. Was it specific and proactive, not just how am I doing? Can I get some feedback? But things like, I want to practice my counseling skills. Can you watch me with a patient and give me feedback? So that's specific and proactive, and it requests observation. Those would weigh in favor of judging as more sincere. But there's this other thing that could come with a request, which was fulfilling a requirement. I need to get 5 forms filled out by the end of the week, so can you give me feedback? And we can talk about that at the end. The second factor was timing. Feedback requests could come, if they came early, that's great. You really want to get some feedback as the rotation is going on. Too late, like asking for feedback on the last day, was thought to be, well, you don't really want feedback because there's nothing for you to work on anymore. But it could also be too early, like, I haven't even observed you yet. Why are you asking me for feedback? And it also could come at the wrong time, like this quote, girl, read the room. I'm exhausted. I'm on my way out of the OR. Why are you stopping me now to ask for feedback? Pre-existing relationships also affected the judgment. So if they already knew someone and had worked with them, they might already have pre-existing assumptions about how sincere they were, and including, have they responded to previous feedback I gave them? A third factor was learner characteristics. For example, a lot of times when people would be approached for feedback, the learner would appear anxious, nervous, or insecure, but this could lead to different attributions, which was interesting. So in some cases, when a resident seemed to really be struggling and self-searching, that was thought to be a really sincere request because you can see how much they're struggling. They must really want this feedback. But on the other hand, if someone was judged to be sort of anxious or nervous because they had low self-esteem, that could be interpreted as they just want a pat on the back. They just want to hear good things about themselves. So this was kind of tricky. And then another factor was, how do they react once you start giving them the feedback? And for example, if they're pushing back, if they're arguing, they're cutting you off, or they dismissive, I'm sure we've all had these experiences. And one person said they were so surprised because someone asked them for feedback. They started giving the feedback, and this guy was like looking down and shaking his head and disagreeing. So then it would feel like that was not sincere. And then the last thing we asked, which was interesting, was, do you think that your assumptions about their motivation affected the feedback you gave? Mostly they say no, I just give the same feedback no matter what. But again, with probing, there were some things, for example, if they seem to really like the subject or are in your area, you might give better feedback, more detailed. Or if they're further on in their training and about to enter practice, you might give different feedback. And also they would admit that sincerity had some effect on the type of feedback they gave. So I'm going to stop there. That's at the end of the results. and see if there are any questions.
So I'm gonna, any questions about this concept of surveying supervisors about how they interpret a feedback conversation that's initiated by a learner? And I know we have residency people here and medical student people here, so I'd love to hear both perspectives, just so Shiphra can meet two different perspectives from our community.
I just wanted to mention, I put in the chat, Alice, that if anyone had any questions and they can't unmute, they can just put them in the chat and I'll be looking for them. This is Stacy, by the way. I should have said that first. Hi. But I actually had a question of my own. So our feedback advisory council is looking in our faculty advisory council, excuse me. One of the subcommittees is looking at feedback, and we've noticed going through the literature that there is much less than you would think about this idea of perceptions, and that the understanding of the assumptions people are making when giving and receiving is not as fully explored as we had thought. So and so that's why I was really interested in your paper. So
Thank you.
Were the results surprising? Did you suspect that or hypothesize that you were going to get that?
So yeah,
I really do assume things.
Yeah, so thank you for bringing that up. And that was actually, we wrote a section in the paper, as you should do for qualitative research, especially in areas like using methods like constructivist grounded theory, because it is a constructivist approach and you are bringing your own self and preconceptions and ideas and experiences into the research process and sort of co-constructing meaning with your participants. So we did have, for sure, issues where, oh my gosh, there's some people that they're just constantly, they literally like following you around the ward. They follow you to the bathroom and they're always asking for feedback. And you're like, oh my gosh, do you even want feedback? So we had our own experiences and also people that you give feedback over and over and they don't seem to take it up. And you're like, why are you asking again? And so from a researcher point of view and clinicians and practitioners, we were definitely interested in this. And we expected to find a range of motivations. I expected people to be as irritated as I was by these requests sometimes. So anyways, why don't I go into the discussion and we can get into some of it. With the incredible foresight of Lorelei Lingard, who is at the forefront of figuring out how to use AI in our research, we played around with a lot of different images to try to construct, I'm very not visual. I had something with like a Venn diagram and different, org chart things. But when we came up with this image with the help of DALL-E, it really seemed to encapsulate what we were struggling with. So basically, you can see here, a learner is requesting feedback from a supervisor. And she is kind of knitting in her own reactions, perceived motivation of the learner, and how she's basing these assumptions and sort of knitting together this nice fabric of a feedback conversation with these entangled threads. But as you can see, both the learner and the supervisor are really only focused on this one ball, which is the learner's request for feedback, and kind of like the other things are there, but they're not acknowledged. And that, for me, was really the crux of it. Neither side is fully aware of these assumptions that they're making, and the assumptions might be really flawed. And there's abundant literature on our faulty assumptions as human beings, but it's really problematic if we turn feedback seeking into a behavior that everyone must demonstrate and also be evaluated on. It's really problematic. So, you know, one area is this idea, we call them the how am I doing requests. So learners who ask, how am I doing? They may believe they're exhibiting good feedback seeking behavior, but it could be interpreted as insincere. You just want a pat on the head. But it actually turns out sometimes when people ask, how am I doing? It's a more of an existential question. They're asking about their progress, their trajectory, their belonging in a field. And so we have to be particularly careful with these requests that we don't unfairly dismiss them. Another one is, I need this form filled out, which is so unfair that we judge these requests as being less sincere because they come with this instrumental need to have something done in a transactional way. But we have forced this situation, and our supervisors in the study recognize that it's not fair because the learners are having to do this. So it forces learners to navigate a performance of feedback seeking without appearing as though they're just performing feedback seeking. So that again is a bit unfair to trainees. And this idea that if someone hasn't improved based on previous feedback and we judge that really harshly, that's also unfair because it may be that, you know, maybe your feedback wasn't that good and that's why they haven't improved yet. Or maybe they're improving in other ways that are not visible. So we have to think about what is the outcome that we're observing. And, sorry, an opportunity to explore, well, I've already given you this feedback. Can we talk about what you're still struggling with? And so making assumptions is human for sure, but we do tend to think things are more insincere if they are not specific, poorly timed, if previous feedback was not incorporated, or if it comes with a stack of forms. And so we do need to maybe teach on both sides of that dyad about what are these assumptions and how can we work together to avoid them. Avoiding putting more onus on the learner, and also avoiding judging harshly if a learner appears defensive. Some research shows that defensiveness when getting critical feedback is normal and it's ego protective, and it doesn't necessarily mean that that person won't think about it and improve at another time. So I'm going to end with this because I love this picture, but feedback seeking can be an explosive topic. And it should prompt us to really consider the assumptions we make about each other. And I'm going to leave it there for questions.
You could stop sharing your screen. I'm going to put us in gallery view for a minute.
Yeah.
Okay, gallery, great. So any thoughts on this topic of people seeking? And I'd like something from the medical school, because from what I recall, and I could be a little off my medical school people, we have the students actually initiate who they would want to get feedback from in the clinical setting during their third year rotations. Is that accurate, Gabby? Do you know that?
That's my understanding, but I am not actively involved in the second 100 weeks, but that is my
Right. Yeah, so they actually hand ask people specifically who they think they've spent time with to give feedback on their clinical skills during the third year. And I don't know how uncomfortable, I don't think I have any students on today. I'm glad to hear Samara's here as one of our vice deans. We came up with this process to get the best quality feedback, I think was the intention. Like, you know who you worked with, so that person should give feedback. But I'm just wondering, do you think, Shiphra, that is a good idea for a young learner, like a third year medical student, to be handpicking people to give them feedback?
Well, it depends. I want to make sure we're talking about feedback and not assessments. I think in terms of assessments, it can be problematic to ask people to choose their assessors because they may sort of cherry pick and go with the ones they know, give them all 5s out of 5s, or just ask for assessments on things that they know they're already doing well. When it comes to feedback, I think the learner should have some agency and some control over who they're asking for feedback from. Hopefully, they will ask for feedback from people who have actually observed them and they have a trusting relationship with, that they will maybe incorporate that feedback. I think if all feedback dyads are assigned, I wonder if some may work better than others, and it may disengage learners who don't feel they have a connection with that person.
Sunita, for the first 2 years, do the students actually do any approach to their clinical supervisors for feedback, or do they just wait? Sunita's involved in our first 2-year clinical.
Hello. Hi. Yeah, I mean, if there isn't a formal process like that, we encourage them to ask for feedback and for the preceptors to give them feedback, but formal feedback, they're waiting for their assessment.
Yeah.
But it's not like, they have their preceptors, like in third year, right? The students can assign direct observation forms to their attendings or even residents, as I understand, where there's a checklist. I don't think in the first 2 years, the students, it's just either you ask for feedback or your preceptor gives it to you, and of course there's the assessment.
But how do you think supervisors would feel if a student was asking for feedback? You think they'd feel uncomfortable, or that it was, oh, this is great, my student is so willing to learn type comment?
I think it's variable, right? So I think some of us feel very comfortable and some of us don't feel as comfortable giving direct feedback, and that's what we see all the time.
Right.
I see a hand up in the corner.
Where do
Yeah,
I see?
hi, thanks. I just wanted to offer that we started our new internal medicine residency, and we're interested in trying to make things better with feedback, both giving it and receiving it. And one of the things we did is we modeled after North Shore and LIJ, where we have feedback Fridays. And so it's kind of built in, not as you have to do this for me or I have to do this, but and what we really kind of liked about it is that we were concerned that if an intern or a resident, does their 2 or 4 week rotation and then gets feedback at the end saying, well, you should have done a better job with your notes, where, they're upset. They said, well, I never had an opportunity to do better because you're telling me after it's over. And so it kind of builds in expectations and also gives an opportunity for the learner to, request of the attending to say, hey, during the week, if I'm trying to get better on my notes and you see something, tell me then, or, hey, I want to get better at reading EKGs. So it almost becomes a two-way dialogue. So we, not everybody does it. We're still having a problem with making sure everyone does it, but I think we like it as a concept to take the sting out of, this is just a mandatory thing I'm doing.
Yeah, that's a great idea. And there's also some interesting literature on feedback literacy out of the group in Australia, where they actively teach learners in their medical programs what feedback is, why it's important, how to seek it, how to incorporate it, how to approach feedback conversations. And so rather than just teaching faculty how to deliver good feedback, it's more about the dyad.
That's a wonderful idea. That's in the medical education literature, that work, Shiphra?
Yeah. Look up the work of Elizabeth Molloy, Molloy.
I would just add one thing that I'm thinking while I'm listening. We recently taught our second-year medical students sharing emotionally challenging news, and we encourage them to think about their emotional state and their well-being before they enter the conversation. And I think there probably is some element here also that we have to recognize our own emotions and our perceptions and be aware of the students' emotions and perceptions, which is underlying this. So perhaps we need to better align how we teach sharing emotionally challenging news with patients with how we're sharing some of this information with our learners.
Okay, great. Okay, I think it's over to Andrea now.
Yeah, any other comments? We'll close this out, and I'm thrilled to welcome
Has their
our
hand up.
Hi,
second
this is
article.
Atika Ismail. How are you?
Andrea, you ready to go?
Sure, let me work on the screen
Great.
here.
And maybe you can give a little intro on yourself so they know who you are.
Sure. So I think that's sharing the presentation view of my screen now. Let me know if it isn't. Andrea Gingerich, I'm an associate professor I'm at the Northern Medical Program, which is a distributed site of UBC Medicine. So I'm in Prince George, which is about halfway between Vancouver and Alaska in British Columbia. So thank you for the invitation to be here today. Happy to present this work on behalf of our team, and we're grateful for funding that came from the Medical Council of Canada. So as our assessment programs have embraced more low stakes workplace-based assessments, there's less opportunity for individual supervisors to fail learners, and there's more emphasis on individual supervisors regularly documenting feedback and performance information. But unfortunately, our written comments are not always as comprehensive and descriptive as they need to be. And so it seems that we're shifting from this phenomenon of failure to fail to one of failure to write. Supervisors are blamed for both of these phenomena, and perhaps reasonably so, because I can pretty much guarantee that everyone here has chosen not to write something on an assessment form that we absolutely could have written and knew that we should write, but didn't because of some of the consequences that may come of it, whether those are real or imagined. And the thing is, we have a pretty good understanding of that part of the story, and that's not what this study's about. This study came about because in our earlier work, we were looking at how supervisors identify underperforming learners. And a few of them told us about this situation where they were very motivated to put something on a form, but when they went to do it, they could not find a way to wrangle what they needed to say into an assessment comment and put it on a form. So that meant that that information remained unwritten, even though they wanted it written. And so we wanted to study those unwritten comments because we knew that supervisors were unwilling to write some information for a bunch of different reasons, but we started to wonder if some comments were unwritable. So I'm the first to admit that trying to study something that isn't there is methodologically challenging. And that was actually part of the fun of trying to design this study and what got us interested in moving forward to it. We needed to use a bunch of different tools to try to get at that information. One was this shift. So instead of focusing on supervisors being resistant to writing assessment comments, we wanted to focus on the information that resists being written. It's a rhetorical device, and we found it useful to help move us away from that failure to fail phenomenon and into this failure to write phenomenon. To actually do that, we invited supervisors from across Canada to share online examples of when they found it very difficult to put information into assessment comments. Thankfully, 50 people did this. And we went through those different examples and we selected the ones that were the coolest and that represented supervisors from a range of different specialties and demographic factors. And we invited them to participate in an interview. Fortunately, 13 people did that with us. So in that interview, we did want to get more details about that example they shared, and if there were any other even better examples that they wanted to share. But we knew this was something that they couldn't get at. They might not get at fully by just asking regular interview questions. So we did some specialized prompts. We also did a couple exercises. So early on, we had people respond to a very short video clip that I had used in previous research that we knew was a bit tricky to put into words on paper. And then after that, we actually asked them to try to write the assessment comments in real time for that example that had been unwritable previously. And then to tell it so that we could watch what they were writing, what they were editing out. And then quite often they say like, sometimes it could be writable, but they wouldn't put it on the form for various reasons. And we would dig into it in those levels. We use constructive grounded theory to inform our approach to data collection and analysis. And I'll pause here to get some questions on the introduction and the methods.
Could you repeat the theory that you used? I'm sorry, I missed it.
Oh, just grounded theory.
Grounded theory. Any questions on this methods that were described here? Also qualitative methods. So we see that qualitative methods are very dominant in medical education research, certainly mixed methods, and both of these studies were 100% qualitative. Any questions about the recruitment, anything? I just want to be clear. So did all the groups get the video and all the groups got the prompt, or that was divided up?
So everyone got the kind of specialized prompts. The first two participants, we used the video and it worked okay. And then we tried the writing exercise and that worked even better. So we stuck with the writing exercise for the rest of the interviews.
So you actually changed that piece of the methodology after
Oh yeah,
the
yeah,
first
you can
two.
do that. So in constructivist grounded theory, data collection is iterative, and so you're analyzing and collecting data at the same time, often in kind of rounds, and then you're using what you're finding to figure out how you're going to collect it later on. And so that those changes are meant to happen. It's not a deviation from a protocol. So the interview isn't like a verbal survey. It's trying to make meaning. You're constructing meaning from the collecting data and the analysis.
Okay, wonderful. Thank you. Any other questions or comments? Great. Okay, why don't we continue?
Yeah, why don't I tell you a bit about what we found then? So through the analysis, we learned that not all performance information is equally writable, and that the information that resists being written was more of an essay than a comment, that it really wasn't assessment information, or it better belonged in a conversation than on an assessment form. And these could overlap a bit, but I'm going to try to describe each individually so you can get a sense of them. So information resisted being written if it was, unwieldy and cumbersome, and it required a lot of background information before it could be understandable, because it was just so contextually bound or nuanced that you couldn't easily condense it into a pithy comment. I put the example here of passive aggressive communication because one of those things, it's not really what you said, it's kind of around like why you said it or when you said it or how it was, in this whole communication exchange. So to try to say that and then indicate why it was suboptimal and how you could do that differently just would take up a lot of space. So perhaps could be writable, but not easily as an assessment comment. Irrelevant and unverifiable information resisted being written, which is good because it's not assessment data. But the tricky part is, although some information was clearly relevant, there was a lot of information that people were doing some kind of complicated mental gymnastics to figure out if it was valid enough to put on an assessment form. So for example, there's topics that the relevance seems to be evolving, and people thought perhaps previously they would have been encouraged to use it as assessment information, but that now you probably shouldn't talk about that anymore and it's not appropriate. Things like work ethic, taking days off, professional dress, accents came up as examples. Then there were also some behaviors that could be directly observed, but supervisors felt like they couldn't verify them and weren't sure about putting them on a form because they didn't have proof that it occurred. An example was seeing a learner roll their eyes while a colleague was speaking. So it was witnessed, but again, that has to be interpreted. And if they felt like they were the only one that saw it, then it became, it was a bit more difficult about whether or not that was assessment information. And then finally, private information that was shared within the sanctity of an educational alliance was not written as assessment comments if it was felt that it would be harmful to the learner or to the supervisor relationship if it was disclosed publicly. So it seems like there's some topics that are considered more suitable for a coaching or a mentorship conversation, and that didn't need to be documented in detail on a form. So maybe some higher order general level comment would be made, but not specifics. Examples here were like around personal hygiene, mental health, performance anxiety would be discussed in feedback conversations, but not as openly put on an assessment form. So that was, a broad overview of the results. Love to hear if there's any questions or reactions to that.
Any thoughts on the results? What were the most surprising results to you, Andrea?
I think overall, it was really fun to try to get away from the failure to fail stuff of just not wanting to write assessment comments, because I think we all have that close lived experience of the not wanting to, because it would take too much time or might get you into trouble or create more work for you later on. The most interesting, I don't know what's surprised, the most interesting for me was this idea of not wanting to harm a learner by writing something down that seemed like it was more of an intimate, personal conversation. That it was important to discuss with them, and that it was something they needed to work on, and that you were working on it together, but that telling other people really seemed like a violation of trust and unnecessary exposure of who that learner was and what they were grappling with, and that all that needed to be documented on an assessment form was like, either we're working on it or things are going fine, like don't look here, unless it got to that stage where it was really problematic, that you would put down details. Yeah.
Hi, this is Stacy again. Did you find, again, going back to the perceptions and assumptions piece, did you find that they were likely to have conversations afterwards, like picking up on what you just said about how they didn't want to write it down because it would be too punitive, that they still followed it up with difficult conversations, perhaps, but just didn't put it officially in writing?
Yeah, often the conversation happened first, and there was the decision of what are you going to disclose on the form. Yeah, because so this is one of those things about interviews. You can ask people, the questions reviewers want are the very straightforward, obvious, you're interested in this, ask them flat out about that same thing. When we ask people what assessment comments are for, we get answers like, it is a summary of our feedback conversation, or it is, sort of a transcription of a direct observation. And that's kind of what we're told in faculty development. Like it's quite simple, it's objective, you just put this down, it's easy, document it, move on. But that's not what we heard for these, sometimes that is, but for some of these really important things, it was, yeah, we've been having lots of conversations on performance anxiety, and they're improving. And I think documenting details about their performance anxiety on this assessment form will make the performance anxiety worse. And do they really need to know that, right? Like, it's those sorts of things. So even though all of the feedback is around how to deal with performance anxiety and how that's impacting your actual ability to meet the criteria, what you put down would be something higher level and something different to protect the learner in that situation.
Great. It's interesting.
Sorry,
Go ahead. No, continue, because time-wise, please continue.
Yeah. I'll finish up and then we can touch on anything in the last little bit. So based on all of this, what we learned was that by examining the unwritten comments is that we found out that writing assessment comments in general is this moment where the teacher and the assessor roles can come into conflict with each other. Because as a teacher, we have this need to create space that's safe, where learners can be vulnerable and actually learn what they need to learn instead of just performing for us. But as an assessor, we have an obligation to report how well the learner is performing. And like I said before, contrary to what a lot of people told us about it just being this brief transcription of a feedback conversation, or just a neutral recording of events that have been directly observed, that sometimes there's a lot more complicated about that. And we're framing this as it was this moment in time where writing assessment comments is really this act of disclosure by supervisors of something that was in this learner-supervisor relationship, that now you're not just reporting it back to the learner as kind of a memory aid, but you're also disclosing it to sometimes unknown others, and in what seemed like a very permanent and public way. I want us to bring us back to this idea of this failure to write and not putting as much detail and being as comprehensive as we should be on the assessment comments, and consider how problematic that is. So from this, assessment perspective, we can think about omitted performance information means it's not there for our official decision making. It can lead to informal conversations. It can weaken our assessment decisions. From that teaching perspective, perhaps omitting some information from a permanent record could be beneficial if it means you can have these authentic learning experiences and safe feedback conversations, and people and learners can improve. Really, it's just our choice to design workplace-based assessment with written comments that are supposed to reflect both feedback and assessment data can place supervisors in a difficult position. And, it makes me wonder that if we're expecting supervisors to do something that isn't as possible as it seems, and perhaps we shouldn't be as surprised when they resist doing it sometimes. So, I put this question back to you. Should all important details from a feedback conversation be recorded in writing on an assessment form? And then I'll open it up if someone had a question from any of the other sections that they didn't get a chance to ask. Happy to touch.
Andrea, can I ask a question, even though I was on the study as well? It keeps striking me as being a huge tension of you want to be able to have trusting relationships with your learners and encourage them to seek feedback and for you to give them feedback in, any area, but especially sensitive areas. And it does, in some ways, feels like then a betrayal to then write it down for other people to look at, because maybe part of what we're doing is we're maybe shifting our, not allegiance, I don't know what the right word is. It's like I'm on the side of the trainee, but I also am part of this program, and there's a need for documentation. I don't think there's a solution. I think we maybe have to recognize that, yes, both these things are true and deal with it. I don't know.
Well, so the solution, I'm not sure, but yeah, absolutely. It's almost like a double agent sometimes. We have these dual responsibilities and then these dual tasks that we're being asked to do. We had participants who compared it to patient notes, like what you talk about with a patient, what you put in your notes, and you have some obligations to document certain things, and other times you leave some stuff out in case your notes are subpoenaed, that sort of thing. It's similar to that decision. And we had someone else who said it's even different than patient notes, because patient notes are they felt like were for you as the physician, whereas third-party forms, like doing insurance forms and reporting to somewhere else, that assessment forms were more like that, and where you wanted to be very careful about how you worded things on a third-party form. And similarly, you want to be very careful about how you worded things on an assessment form, because other people were going to interpret what you said, and they may interpret it a little bit differently if you didn't quite write it the correct way, or a way that fit with how they were doing it. So there was lots of concerns about things being taken out of context, being weighted to negative things, being weighted way too heavily, or becoming way too salient when what they meant was a very small thing. So yeah, I think one is just recognizing this is a lot bigger decision, a point, than what we might think when we think about assessment comments is just simply writing things down.
But
and
I also, go ahead, Taranjeet.
I was just going to say, I wanted to share a real life example of something that happened to me. I wrote a letter for a student. She was in my case-based learning group, so I had her for 3 months. So initially, when you meet the student, she's that one that's asking a lot of questions, almost to the point of disruption. But as I got to know her and, gave mid-course feedback, she really morphed. And then I saw that that curiosity comes from true passion, and that she was always in this improvement realm. So I wrote a really nice letter, and I wrote the sentence, "does not accept the status quo." And that triggered a program director, and he actually picked up the phone and called me. And he said, this was, I just want to understand, when you said this, what did you mean? And so I explained, and it was a great conversation. But that was my way of kind of putting in that, when you first meet her, she may feel abrasive, and I said it really, really in a way that I think you had to read between the lines, and that person did, and picked up the phone and called, and she did well. But this way, because it's this toggle between us being credible right? Like, and making sure that we are recommending somebody that we truly believe in, but also being honest in a way. So
yeah, being honest, and then also worrying about how those words are going to be interpreted and how much work is going to come back on you, or how you are going to be viewed in light of the assessment comments. So we have people telling us about that too. We had some examples where people said if they were commenting on something that was gender-based or race-based, and they were the minority person in their department, they worried about commenting on it and getting that phone call from the program director saying, why are you saying this is a big deal? And being faced with needing to explain why that was there was a gendered interaction that went on, and that wasn't appropriate. They're like, I don't even know how to start this as an assessment comment, because really it's all about these other things. So yeah, more complex than what we might first think.
And Taryn G, how long did it take you to write those comments the way you thought about them? I'm sure the time factor that it took, not everybody is willing to devote that amount of time
I
to those
saved like
thoughtful ways. But
right. So I'd saved her comments from her. I had like a file that I would keep on all my Pearl students. So when she asked for a letter of rec, that showed to me she trusts me, and I did write a very trustworthy letter. But I also think that it was important to me to share that in that context.
I'm going to have Noah go, but I just want to say one comment in reply to Andrea, and then Noah, you'll go, is Andrea, I'm sorry, Andrea. I think most people are afraid after they write a comment, then there's going to be a discussion about the comment, and then I have to talk to somebody about it, and then there's going to be a negative on me, or it's not going to turn out the way it should. And all that stuff prevents writing comments. But honestly, if you don't write comments, the numbers are just numbers, and people are like, I'm a 3, I'm a 4, I'm a 5, whatever it is. But who am I really in my identity as X, whatever they're doing? You don't get that without good comments. So I think we have to continue to work on comments, because without comments, people really can't develop. Noah, did you want to say something? I see your hand up.
Thank you. Thanks, Alice. And thank you both for these really interesting discussions of your articles. I just had a little comment. I'm also Canadian, so thank you for coming and visiting with us. I really think it's interesting that you mentioned protecting the learner, because a lot of the things I think about when we think of learners who are struggling, or residents who are struggling, or whatever, they've spent so much time and energy getting to the point where they're an MD or a DO or whatever, and they're at this situation. And if they're struggling, it's partly our job as the teacher to also protect the learner, protect the public. And I think it's really interesting because when you think of regulation of our specialty, I'm a surgeon, and part of the tension in the US, I'm not sure so much in Canada, but the regulation of the specialty is done through surgeons, right? The fellow of the American College of Surgeons certifies, American Board of Surgery certifies the participants. If you're not board certified, you can't get paid through insurance, etc., except in specific situations. So, part of our job is to protect the public. And I think, if we don't self-regulate the field, which is things that people are talking about in my field, then it is incumbent upon the hospital or the government to do it for us. So if we don't do a good job of it, then it'll get taken away.
Right.
So that was sort of one of the things that I was thinking about.
So I say yes, and we saw that in our earlier work, and we were asked about identifying and then kind of some failure to fail stuff, that some things are just easier to write down when it comes to that. So there's that big, do I really want to write it down and stop someone's progression? And there comes a point where people are like, I have to protect the public and the profession, except there are some situations where they're like, but it's even then, how do I write it down? So if it's a big error, then that's easy to describe in detail and say why this represents that they have incompetence. But people talked about things where it's like, it's a bunch of little things all over the place. And it looks like this nitpicky laundry list, right? Because like nothing on its own is significant. And it starts to look like you're just kind of over the top with these details. So there were situations where it was still tough to do it well, but you knew that person was going to potentially be dangerous.
Well, having the perspective of how much relevance those pieces of information actually lend to an overall assessment of the learner is really the key part of what you're getting at. It's like, if you make a bunch of small comments that aren't important, why make them?
Yeah, this is what. Yeah, it's more complicated than what it seems that, when we first start thinking about it. So I know we're getting very short on time. So
I just want to say that I appreciate both of you tackling this idea of words. Words have so much meaning in our language. And of course, we're very diverse culturally with our trainees, with our students, and the words are very, very delicate and very important. So I really appreciate the research methodology of really going into the words, not just numbers. Leanne, you want to just give your slides quickly before we end, since you made them? And both of these articles, of course, are very recent, so data might be limited. Leanna? Sorry.
Yeah, sure. So I'm Leanna Steger. I'm the scholarly publications librarian for the school and Northwell Health. I just want to talk a little bit about the bibliometrics for these articles this month. All this data is from the Dimensions database. So the growth mindset article has been cited 4 times, and that includes a mention on the Journal of Graduate Medical Education's list of hot non-JGME articles from 2024. It's also been saved 8 times via the Mendeley Citation Manager, which indicates the user intends to go back and read or reread the article and potentially use it in their own work to cite it later. Social media-wise, the article was shared by 5 formerly Twitter users, and 3 Blue Sky users. Blue Sky is a newer alternative to Twitter, and Altmetric has only recently started tracking activity on that platform. These 2 articles are actually the first time I've seen any statistics for Blue Sky shares, so that's pretty cool. And the next article, Praise in Public, has been cited 3 times, saved via Mendeley 7 times. It's been also shared by 5 users and shared once on Blue Sky so far.
Emergency department immediately.
Sorry, I also should note that Andrea's paper won the Best Research Paper Award at RIME this year.
Really?
Yes.
I did not know that when I picked that. See, I just picked.
There you go. You picked a winner.
Oh my God. RIME is an extremely competitive process. So just to get into RIME is competitive, and to win the best research paper, Andrea, congratulations, and thank you, Shiphra, for sharing. Our next journal club is also coming from RIME. The rest of the year is, I did February, March, April, and May are all RIME articles. And Sally Santon is going to be presenting on the concept of 3rd and 4th year medical student graduates and how do they perform as interns. But in general, this concept of 3 versus 4 year medical schools, I don't know how big this is in Canada, but it's a very, very big discussion. Is a very big discussion item, and I'm looking forward to this discussion. The eval form is here, and maybe we could put that in the chat, but you'll get it
I
as
put a link in the chat
for attending also, and get a copy of the slides from today. I am babysitting a dog, so I apologize profusely. He's not happy with me. Any last comments? We're at 1 o'clock. We did 2 articles, as said, and we continue this feedback, I said, puzzle, enigma. How do we get it right? Be it quantitative data, qualitative data, comments, supervisors, learners. I'm looking forward to looking at the Australia articles for feedback literacy. And thank you all for coming and joining from Canada and the US.
Thanks, Alice.
Thank you very
thanks
much.
for inviting us.
Thank you.
Have a good day, everyone.
Yeah.
Bye-bye.